Hi, my name is April Tillman. I'm the lactation consultant here at Colquitt Regional, and I'd like to take just a few minutes to give you some facts about breastfeeding so that together with your healthcare team, we can help you reach your feeding goals for your precious new baby. So first off, I want to tell you that breastfeeding is normal in the United States. There's actually 83% of all newborns born in the United States breastfeed at some point. Breastfeeding should not be painful. You may feel some discomfort like you did at the beginning of your pregnancy, but there should never be any severe pain. If you experience that, reach out to your healthcare provider or a lactation consultant like myself for further evaluation. Nursing is not always easy at first. It's natural, but it's a new skill for both you and your baby. So be patient and take some time to learn how to breastfeed. Get support from family or friends or someone in your healthcare team like a lactation consultant. Newborns must feed at night. Newborns don't know the difference between day and night, and they need frequent, easily digested feeds both day and night. Your milk contains millions of nutrients that are specific to you and your baby, and they are ever changing. Bottles work differently than breast. A baby will use their jaw, mouth muscles, and their tongue to remove the milk from your breast. With a bottle, the nipple is different. It feels different, it's shaped differently, and the flow is very different. They don't have to use as many muscles for a bottle like they do the breast. So I encourage you, if you're going to use a bottle, to learn how to safely bottle feed your baby. You can breastfeed in public now, and if you go back to work or school. There are new laws in place in the United States that require your employer or your school to provide a safe place for you to pump your milk when you're away from your baby. You can breastfeed if you smoke, vape, or even take medications. Most medications are safe for breastfeeding. Ask your doctor if you're concerned about any medications that you might be taking. If you're going to smoke or vape, it's actually better to breastfeed than not to breastfeed. Now let's talk about what you can expect at Colquitt Regional after the delivery of your baby. Right after your baby is born, your baby will be placed skin to skin. Skin to skin is when we take your baby and we put your baby's chest up against your chest with their arms out to the side, and their legs will rest on your abdomen. Baby's face is turned to one side so that you can easily see the baby's face at all times. Skin to skin is practiced here at Colquitt Regional during a vaginal delivery or cesarean in the operating room, or as soon as possible in the recovery room. You'll notice that your baby has a cream on its skin that's called vernix. This vernix is very important for your baby because it helps to provide warmth and it keeps your baby from infections. Babies like to breastfeed during that first hour, so we do uninterrupted skin-to-skin time for at least 1 hour or two until you complete that feed. Nurses will come in and check vital signs periodically during your skin-to-skin time. They'll check the baby's temperature, respirations, and their heart rate. After your skin-to-skin care is complete, the nurse may take your baby to the warmer and they'll do a thorough assessment of your baby, which will include giving vitamin K injections and also hepatitis B vaccines if you would like. All babies will receive the erythromycin ointment to the eyes. This protects the baby from any bacteria that they may have come in contact with during the delivery. Skin to skin is so vital for your baby. It helps to keep your baby calm right after delivery, and it also helps them to adjust to life outside of the womb. It keeps your baby's blood sugars high, and it also helps to regulate their respirations. At Colquitt Regional, we follow the 10 steps to successful breastfeeding that's set forth by the World Health Organization. They recommend that you stay with your baby for 24 hours a day. Rooming in helps your baby to take comfort because they know that you're close by. They can identify your smell and your voice, and it keeps them calm. You can learn your baby's feeding cues. You can feed anytime your baby gets hungry. It also increases your milk production, and it actually helps you get a little more rest and sleep because your baby is calm because they feel safe and secure close to you. Responding to your baby's feeding cues helps them to feel safe. Babies know what they need, so watch your baby and not the clock. Hunger cues that your baby may show are anytime your baby wakes up in the first few days, nuzzling into your breast, rooting, turning its head from side to side with its mouth open, fist clenched tight and close to the center of their chest, sucking on their hands or their tongue, and crying. If your baby is crying, that's a late sign of hunger. So you may need to calm your baby by gently rocking them from side to side, or you can do skin-to-skin care just like you did after delivery. We recommend that you avoid pacifiers for the first few days or until your breastfeeding is well established. Pacifiers can hide feeding cues and create more problems. Your baby's tummy is very small. It's only about the size of a grape, so it can only hold about 5 to 7 milliliters at one feeding. Your colostrum is very concentrated, and there's only a small amount, and it's very easy for the baby to digest, which means the baby may want to eat a lot. So breastfed babies like to cluster feed. That means they're going to want to eat every hour for a few hours, and then they're going to get full, and then they're going to go into a nice little sleep cycle. And we're going to just let them sleep for a few hours. That way, then when they wake up, they're going to be ready to eat again. That's all normal newborn behavior. Let's talk about your colostrum. Your colostrum is the perfect first food for your baby. It provides lots of antibodies to help fight off disease, and it's easy to digest, like we said just a minute ago. So it helps to lessen cramping and gas for the baby. It comes in small amounts. That's normal, and that's because your baby's belly is so tiny. And then over the next 3 to 5 days, your mature milk will come in. There'll be a larger volume of this milk because it contains more water to help satisfy the baby's thirst and its growing belly. Anytime you introduce commercial formulas, it hinders your breastfeeding because you're skipping the opportunity to remove the milk from your breast. In order to keep your milk supply up, you need to take the milk out. So it's a supply and demand kind of thing. The more milk you take out, the more milk your body will make. So let's talk about proper position and latch. Okay, mamas, when you get ready to breastfeed, the first thing you're going to want to do is get comfortable. Grab a large cup of water and bring your baby to your body with the baby's belly turned into your belly. This keeps the baby's ear, shoulder, and hip all in a line. You're going to place the palm of your hand on the baby's upper back with your thumb and your pointer finger right behind the baby's ear so you have good support of the baby's head. You want to make sure that you bring your nipple into the baby's nose. Wait for the baby to open its mouth really, really wide and then right over the top lip and into the baby's mouth. A good latch is important to prevent nipple pain and nipple damage. This will also help your baby to get more milk, and it'll help you to produce more milk as well. So how do we know that your baby is getting enough milk? Well, the number one sign that your baby is getting the nutrients that it needs is by their pees and poops. So your baby should have 1 pee and 1 poop for the first 24 hours. You should have 2 pees and 2 poops for the second 24 hours. And on day 3, they should have 3 and 3, and so forth and so on. It kind of levels out by the time you get to day 5 and 6, and you should it levels out on day 5 and 6 so that you're getting the same amount each day from there on out. You should be sure to feed your baby at least 8 times in a 24-hour period. And contact your pediatrician if you feel like something is just not going right. If your baby is not feeding well, it's important to reach out to someone.